The worry about coughing and sneezing again is a very common concern. Again, as a very experienced surgeon, I can report to you that very few people actually do this during surgery, and most of the time if a patient feels like they want to cough, they will be able to alert the nurse or the surgeon carrying out the operation, who can then manage the situation by removing instruments and so on. So generally speaking, it's not a concern. If you have a particularly active cough at the time of your planned operation, it might be best to defer the operation until you're a little bit more settled. But the surgeon and yourself can kind of come to a clear view about that on the day of the actual planned operation.